Welcome. We're back at the 12th Congress of the World Federation of Pediatric Intensive and Critical Care Societies. I'm Tracy Walbrink, the Education Chair for WFPICCS, and we're here in day 3 of the formal program. I'm here with Dr. Jackie Ong. I wonder if you don't mind just saying your name, where you're from, and what you do back home.
Okay. Hi, my name is Jackie Ong. I work at the National University Hospital in Singapore. I'm currently the head of the Pediatric Critical Care Unit. And yeah, I'm here as part of the WFPICCS board and excited because it's the first in-person meeting in 6 years since it was last held in Singapore in 2018.
That's awesome. Now, you've been on the board for a long time. What advice do you have to people? Why should people come to WFPICCS in Melbourne in 2026?
Okay, everybody should come to WFPICCS in 2026. I think it's the fact that it's been a wonderful international community. It's the one meeting where I really get to meet all my colleagues from all over the world. It's particularly special this time because there have been, as Tracy knows, and many of you listening may know, I'm quite active on Twitter or X and social media, and it's been wonderful to connect with people in person for the first time in a long time. I think it's the one place where you can really network and meet people who you've seen online, interacted over reading their papers, and all these senior people do come to these meetings, and it's a great place to form connections. Yeah.
Great. Wonderful. And now you've given some talks today on artificial intelligence and social media.
Yeah.
I wonder if you have any advice or a couple take-home points that you think people should know from either of those sessions.
Okay.
Yeah.
It's hard. I think AI and using large language models and ChatGPT is here to stay. I suppose my summary to that is that it is a tool. It needs to be used with wisdom, intentionally, and with reflection. I think in part you get what you give into it. I suppose if you put in. It will learn from what is existing in the internet, and I think there is plenty of, unfortunately, a lot of misinformation, but I think if we learn to use it wisely, it can be a great asset in many aspects of care. In terms of social media, I think that I absolutely acknowledge that X and Twitter has its problems, and I think we're navigating that landscape, but I think X has still remained one of the best ways to interact professionally with colleagues from around the region, and there's been a lot of interaction, research collaboration that has come out of that interaction. So I would, again, wisdom needs to be used with it. There's been a lot of, there are papers and information out there on how to use professional social media wisely, and I encourage people to look it up.
Perfect. Well, thank you so much for your tips and strategies, and we'll hope we see many of people in Melbourne in 2026.
Absolutely. Come to Melbourne. Thank you very much,
Good luck with your session.
Thank you.
Right. Sounds good. Nice to see you. Okay. Thank you. All right. Yeah. And we are, maybe we can pan a little bit over to a little bit of the crowd. Can one of you go get Heidi's story at the booth? At our booth? In front of the sign, it's been very busy, so we've been pivoting around a little bit here. I'm here with Dr. Brenda Mora, who's our current president of WFPICCS for a few more hours.
Exactly.
And Brenda, what do you think, what has been fantastic about this meeting? I know we've talked before, but now that the meeting's coming close to an end, what are your final reflections?
Oh, wow, it's just been amazing. Firstly, of course, to see everybody in 3 dimensions in person, and there really is no replacing the in-person networking that we can engage in this format. So I think the content of the talks has been outstanding, the scientific content, but for me the highlight has been the behind-the-scenes meetings with different interest groups, the collaboration, the networking. And I think we have so many ideas now for moving forward with some global advocacy research specifically, which is what I'm really interested in. And I'm really excited about that. And I think we're just building from strength to strength at every meeting. And the other highlight for me, and I say this so often, is the fact that I think we've really improved our representation globally and from an interprofessional perspective. And to just see especially the allied health professionals,
Yeah.
sharing the stage
Totally.
with all of the other academics and physicians has been
Absolutely.
for me very special.
Totally.
And again, the global representation. So I think those are the things that I've really enjoyed the most and take home from me from here. But yeah, there's so much to do.
Yeah.
There's so much opportunity. So it's
Totally.
exciting. Yeah.
Well, and it was wonderful to see that, especially yours, to bring in so many allied health professionals, nurses, and make sure that the program was really representative of us as individuals and us as a team.
Exactly.
And so I really appreciate that, and I look forward to that continuing in Melbourne.
Thank you.
And
yes, I
any
hope so.
suggestions? Why should people come to Melbourne in 2024?
Well, so first of all, it's Melbourne.
Yes, absolutely.
Which is unbelievable, and I think people get an opportunity to see an amazing place.
Yes.
I think it will be bigger than this meeting. It will be linked to the adult ANZICS ACCCN meeting, and so there's the opportunity for people to engage with their adult colleagues as well. And I know a number of our professionals work in the adult context as well, so I think that gives a different dimension.
Absolutely.
But I think we will have the same representation in terms of global representation, in terms of interprofessional presentations, something for everyone.
Yeah.
And we obviously don't have the scientific content in place yet, but we have been talking for some time already to try and make sure that we really deliver a program that's going to be appropriate for everybody across the world.
Absolutely.
And again, just bringing people together.
Yeah.
And it's such fun.
Yes, indeed. No, well, thank you so much for your leadership over these past 2 years and really focusing us on the team effort. And I hope you have a little bit of time off and vacation before your next endeavor.
Thank
All
you
right.
so much.
Thank you, Brenda. So great to see you. Enjoy the last bit of your meeting.
Thank you.
All right. And we're here next with our next plenary speaker who is joining us. Dr. Heidi Flory will be joining us in just a moment, coming off from the exhibition hall. All right, Dr. Flory, hello. Excellent. Yeah, so if you don't mind just introducing your name, where you're from, what you do.
Okay, sure.
Yeah, you can hold that.
Hi, I'm Heidi Flory. I'm a pediatric intensivist at the University of Michigan in the U.S. And I do my research in pediatric ARDS and sepsis, and in particular in relationship to risk factors, biologic risk factors, and precision medicine techniques, so subphenotype identification to help us to develop more responsive treatment trials in the future and identify treatable traits.
Yeah. Now your talk coming up, your plenary, you're going to close us out tonight.
Yes.
Omics in the PICU. Should we split before we lump or lump before we split?
We lump before we split. Yeah, I was trying to come up with a topic that could help to wrap up the meetings.
Yeah.
And also because over the last several years, I've started to hear people saying, well, it's all going to be precision medicine, so we don't need any definitions like respiratory failure or ARDS or sepsis. It's going to be too generic.
Yep.
And so I'd like to try to make the case that we need both.
Yep.
We need the syndromic definitions, the lumping definitions that help us to start with time-sensitive management that has shown that we can really improve outcomes with those important targets.
Yep.
But then we do have to do the other, and then we have to split and use some of our supervised and unsupervised analytics and omic technologies to identify the subphenotypes, and then from there, and the patients with endotypes or similar biology, so we can move to our precision medicine. So we need both. We need a blend, and I think it's all about balance, so that's why we lump.
Yep.
And then we split.
Perfect. And I'm curious, the future of omics and sort of all of this precision medicine. We're stuck right now with a lot of these tests taking a very long time to come back. And so what are your predictions, or what are your excitements about how can we get this information closer to the time that we're treating these patients?
Yes, fantastic question, and thank you for asking, because that's what's very exciting about right now, and this has been my vision from starting in these biomarker world for over 25 years, because now we're really getting these technologies to be microfluidics based for the biomarkers, and those turnaround times can be 60 to 90 minutes. And now we're working actually on some technology that could do this in whole blood And so my vision would be that then you would get whenever you got a blood gas, you draw that little syringe of blood, and you would put a little bit in the ABG or the blood gas machine, and then you would turn and put a little bit in a microfluidics machine and get all of those cytokines measured within 90 minutes.
Yep.
And then you'd have that in real time at the bedside. And likewise, I think many of the RNA expression technologies are still research-based, but we have other technologies that can help us to move that aspect forward. And we have some functional omics, shall we say, that are being used right now in randomized controlled trials, where patients will get their blood drawn at the site where the patient's randomized to their getting randomized for enrollment in these trials, particularly the precise clinical trials. And then that specimen will get processed at the site and stimulated, and then the remainder gets sent over to the primary institution and measured, and then they will get randomized to a precision medicine-based treatment the next day, and that is at the bedside right now, so it's still in research clinical trials, but it's in human pediatric critical care clinical trials, and these are firsts, and so it actually is coming to a bedside near us right now.
That's fantastic. So exciting.
Yeah, thanks. I'm glad you think so too.
Yeah. Well, thank you so much for giving us a preview of your plenary talk today, and I hope our listeners are out there and will be excited to come and join us all in Melbourne in 2026 and hear more science like you're presenting today.
Great. Love to come to Melbourne or have other team members starting in this field come to Melbourne too and present their new science.
Fantastic.
Thank you so much.
Thank you so much for joining us.
Thanks, Tracy.
Appreciate it. Okay, have
Bye.
a good rest of your day. Good luck with your plenary.
Thanks.
Yeah. Great. Well, we've been chatting a lot about teamwork here for this conference, and I would love to be able to show the team that's been helping to make this live stream possible. So I don't know if our team from OPENPediatrics might be willing to turn the camera around. Chris, you want to say hello? There's Chris behind the scene, and Anne-Marie, who's been helping get all of our learners, get our speakers here, and Lisa as well. So thank you. We couldn't do clinical medicine without a team. We can't do these kind of things without a team. So much appreciated. And thank you all for listening. The next live stream will be with Dr. Cynthia Johnson being the host. And so really excited to finish up this WFPICCS Congress. And I hope all of you have just been able to appreciate through the live stream the enthusiasm and excitement that we're all feeling here at WFPICCS. And hopefully many of you will join us in September 2026 in Melbourne, Australia. So thank you so much for watching, and hopefully see you soon.